Okay, we have one last session, getting to the end of the rainbow, co-creating hope in the community of children and families affected by CTNNB1. Please welcome Dr. David Gosar from Clinical Psychologist, University Medical Center, Ljubljana.
Just to check, can you hear me? Yeah, okay. I'm very thankful to be here with you. I walked around the second floor this morning and there's a sight I've never seen in a hotel. Children playing all around and families together. You're quite a banded community. Today I'll be talking about community as well. I'll probably be recapping most of what you heard today from different speakers, from Dr. Friedman, from Spela, from others here. And I'll be talking about a journey. And all journeys have a starting point, and this is probably it for many, for actually all parents. It's having a newborn. And that moment is filled with joy and anticipation of what is to come, of great hope and appreciation for the joy and blessing we've been given. And that might last. Most often it does not. For parents with rare diseases and for others who face early adversity, that really turns into something else. It turns into an experience of quite different proportions. All of a sudden, all those dreams and thoughts and wishes take a different turn at the doctor's office or the hospital. And that may take different routes. I've talked about that last year in Madrid, where we met some of you. Sometimes it's an odyssey. You go from specialist to specialist, doctor to doctor, until you're lucky enough to get to that one which recognizes the syndrome or has the idea, let's do some genetic testing. And then a new reality dawns upon you. For others, it may be genetic testing as part of screening. For example, in Slovenia, we screen for some rare diseases. And immediately, a parent, a mother, just having gone through labor and had given birth, is now faced with completely new prospects. Challenges which you've heard today. And this experience can be especially daunting, not only because it can shatter the dreams and ideas and hopes of a couple or a family or a sibling, but rather it is a huge load. Just getting clear with all the medical information can be a huge burden for many. As that I hear from parents with rare diseases. I work here at the University Children's Hospital. So this is sort of an idea as to what the experience should be like for those of you and for most parents with rare diseases. This is what communication in a hospital or in a medical setting should look like when they communicate a diagnosis of a rare disease. Clear information, partnering with and providing support, an appropriate environment, timeliness, so getting information quickly and appropriately, smooth transitions and continuity of care. We've heard about that today as well. Effective care by trusted profession, emotional support, empathy, and respect. I have the glimmering feeling that not all of you had that experience. And reading the literature, many parents find the first information to be overwhelming. Often there is a lack of time to ask the questions because there's so much emotion going on that it's hard to think clearly. Often, as I read papers such as this one from last year, parents express the need to get in touch with people who can offer emotional support and connect them to a community like this. So those of you I remember a talk, someone saying, it's just been a year and now I'm part of this great community. That is a very good thing. Also environmental context. I love the second floor of our most prestigious hotel here in Ljubljana, full of toys, clowns, play, and dolls. It's an amazing sight because it's really important to have an environment where you can feel safe that your child is cared for while you're having those important discussions and asking a question or taking your time to think about it. smooth transitions. It's a really hot topic in medicine in general. As someone working in a pediatric hospital, I'm aware that parents often feel, and adolescents often feel, they'd like to stick with us for a bit more, for a year more, for maybe 2 years, not yet. And regarding diagnosis, it's often important that those that do genetic testing are part of the team that treats you, and the doctors, your physician or your neurologist are in touch so that transition goes smoothly. And of course, trusted professionals. Now, I guess some of you might have met medical professionals who were very competent right at the start. They knew what they were doing and you felt that way. For others, that might not have been the experience. And that can be a challenge to look for the right professional. Should we go for a second opinion? Who should I call? I have this friend, I have this cousin, she works at a hospital. Maybe I should ask her. And emotional support. Well, that can be a big one. I guess we all heard Al Friedman's talk. And you can appreciate his journey. And that's what we're talking about today. It's a journey. And on every step, he had a wonderful line. He said, our child brought into our lives compassionate people. Although many parents report that at the start of that journey, that might not always be the case. The help might not come immediately. It's really with our knowledge in the medical community, our appreciation for your community, I hope that is improving. And with the work of my fellow psychologists and other mental health professionals, that will continue to improve. But what's important is that once you get that diagnosis, that's a really important thing. I remember one of the lessons of Al Friedman before was that it's important to have clarity. It's really difficult to sort of work with insecurity or being unclear about what having an illness means. This is from the book Far from the Tree by Andrew Solomon. I can only recommend the book. It's an amazing compilation of interviews, over several thousand, with parents of children who are very different than they are. And this is what he says. Once the course of care is clear, most people can accept it. Since knowledge is power, even very serious illness that you understand can be easier to deal with than less severe ones about which you know nothing. Identity is a function of certitude. Knowing what the next step is really important. And sometimes just knowing about the diagnosis is not enough. Coming to a meeting like this might be an important step in that process. And this is what it entails. You are sitting here watching scientific presentations with sort of slides like this. What happens? How many start to babble? How many start to crawl? When does that happen? Is my child on the right side of the line? You see, studies, they always sort of produce data in terms of averages and variability. And here's where the hope is. I'm really hoping my child is right there on the better side of that line. And I'm thinking, okay, as a parent, I'm trying to figure out what sort of an impact has his specific type of disease have, the mutation, or what does his intellectual disability mean for our family? How should we live? Does that mean it's also for us? One of the consequences is often that parents feel they need to do everything they can to make the best out of it. Isn't that a parent's most fundamental task, to give it all they've got in the shortest time frame they have available? Because with kids, such as children with rare diseases, it's often the first years of life that are really key. So you give it all you've got. You do physiotherapy, you do occupational therapy, you do speech therapy, you do everything else. But there's a catch there as well. It can also be a guilt trip. Have I done enough? I'm trying to do so much. Am I giving everything? Am I sleeping too much? Am I taking care of everybody in my family? It's often that not only are parents that I talk to taking care of their child with special needs or a rare disease, they take care of their siblings. They try and take care of their loved one, their wife, their husband. And it can be taxing. It can be financially difficult. It can be difficult if you're even at the same time doing a job. It's a struggle. And Spieler spoke before about the fight or flight response, right? So that's an interesting thing. We're constantly fighting and and running away and doing all sorts of things and freezing at the same time. And the thing is, it's a natural part of having a relationship with someone, especially your kids. So the usual expectation with children is they leave home, right? So children who don't have a rare disease and don't have disabilities, usually the standard would be they would leave home. And sort of conflicts with them can be a catalyst for that to happen. With children with rare diseases who aren't able to do that, that can be difficult. You can feel frustrated. You can feel that fight response. You can be angry, really angry at them, although they're just being themselves. And that can be really tough. That's difficult. Even more difficult is what we heard from Al Friedman as well, was dealing with death. Many children with rare diseases face a shorter lifespan. That is a huge challenge and a real life-changing experience, according to my own experience. I've taken care of a mother. Her daughter with a rare disease was taken care of at our pulmonology department. And I went to her a few weeks before her daughter died, and she came to me for about a year and a half after her daughter died. And what I found most awe-inspiring was what she told me about the moment that her daughter died. She said, "I'd give anything. I would give anything for just another breath with her, for just another minute with her." But at the same time, she felt she's finally free of the suffering. I'm relieved that she's okay now. So it can be a real contradiction sometimes. So these can be really dark places where destiny takes us, where destiny takes families and parents with rare diseases. And it sometimes takes a dark place to see things in a different light, to see a different light. And that light is certainly hope. So I'd like to share with you what psychology and clinical experience has taught me about hope. Hope is a verb. It's not a feeling by itself. It's not a place. It's something we do. It's doing something. Now, the most famous theory in psychology on hope is Snyder's theory from 2002. And Snyder puts it this way. You need three sort of ingredients to have hope. First, you need a goal. You're looking to get somewhere. You want something to become. You want to become something. The other is a feeling of agency. Agency means having a certain ability, feeling that you have the ability to achieve something, having the confidence, I can do this. This is doable. It is in my power to achieve this. And finally, the third, and just as an important ingredient, is having pathways. So from all the research in psychology, one of the fundamental things about people who have hope is they can create all sorts of different avenues and routes to achieve what they've set out to do. They are creative thinkers. They are able to combine information from people they know and things they read on the internet, and they find different ways of achieving one thing. Why is that important? Because if one pathway is blocked, they find another. So with those ingredients, that can be a powerful thing. So an interesting way in which they studied this powerful thing called hope was talking to parents that visit a Ronald McDonald House. I'm not sure if you know what a Ronald McDonald House is, but some of you do. And I do. This is one in Munich, where I escort parents who go there for treatment abroad from Slovenia. So in a Ronald McDonald House, for those who don't know what that is, it's a house usually nearby a hospital where parents of children can find lodging and the community of each other while their child is being treated at the hospital. So when talking to these parents, what did they find out about hope when children have a rare disease or a severe disability? They found out that parents have goals. Their fundamental goal is to ensure that their child has the best possible life they can have. And that can be something that can change with a diagnosis or a change in the health status of a child. This often leads to a renewed sense of normality, of a new idea as to what quality of life for our family means. This goal setting is not something that's fixed. The goals don't get set when the child is born. At every point of the way, you can reassess and find how to optimize the quality of life of your child. So that's sort of the goal. The other thing is figuring out how you get there. And being here is one of the ways how you get there. So getting informed support from medical professionals, from your family and friends, from members of the online community, and from those of you here, from the rare disease community. So getting information from them as to what are the tricks, what are the ways, what are the pathways by which we can find that quality of life. And obviously online communities, at least as endorsed by parents in these Ronald McDonald houses, are a really important part of that. And finally, agency. So it's really important to know the story of your friends, your fellow members of your rare disease community who've done well. Like Al Friedman said, who've lived a life of fulfillment, of quality, of belonging. And it's clear that you can't do it alone. So knowing about others who've done it before you, who can do it, be it with a rare child with a rare disease or another inspirational person, gives you the emotional fuel to do it amid the uncertainties. And this also, a community like this and many other communities of parents with rare diseases, offers esteem and emotional support, vital fuel for their journey. So let's look at how someone without hope faces their challenge. This is from the paper I cite. Being a single parent, I have an ex-husband who doesn't get it. I have a mother who's a nurse, who's very critical. I have a boyfriend who doesn't know how to take care of himself, so he thinks he's being helpful and he's clueless. Then the senior doctors literally accused me of being incompetent and not understanding the consent for my son's procedure. And that was like the final insult. So you use all your resources and then you start to get tired and you think, I'm running out. I've got no one and nothing left. I don't know what to do next. See, this is an example of someone who has neither the agency nor the resources and is truly frustrating. And in contrast, someone who has hope. I love that Facebook group. On a practice level, I can see what the other kids have achieved. And some of the kids have very similar diagnoses and some of them are kind of different. There's one kid in high school who has also exactly the same genetic condition as my son, and he goes to regular high school. And he has like mild autism, but he walks and talks. He has a cell phone. He has friends. He has very typical life. Seeing these examples provides a lot of hope in starting from ground zero. Facebook helps me to manage my own expectations and gives you hope. Another interesting concept in terms of building hope is one that has previously been frowned upon by psychology, and that is entitlement. What entitlement actually means is I feel I deserve the help and support and the resources because I am in this position. And usually this was sort of understood as a narcissistic trait, but far from it. It is a social concept. And what's interesting is that if hope is a moderator of that relationship between entitlement and satisfaction, life satisfaction, that is. So people who have hope and feel entitlement are far more successful and experience far more life satisfaction because they know how to use the pathways they have available, while those with low hope often fail. So entitlement, having the resources, is really important. Spiel also spoke about some practices which are used in spiritual matters. I think children with rare diseases touch upon a deeper spiritual question, and that is, who is a person? Who has, if you want to put it that way, a soul? Does that person have to speak? Does that person have to walk? What does it take? What makes a person? Is a child who can neither walk nor talk, breathes but loves their parents. Does he have a soul? I think these questions really touch upon deeper things we experience when dealing with with children with rare diseases. But what is often of help is spirituality. Many parents report their religion or spiritual practice are of great help. Mindfulness was already discussed. So spirituality in all its forms can be an important source of hope. And interestingly, hope is taught to children by children's movies. Disney movies. Who would have thought that Disney's movies would be a great teacher of hope? But they are. Every Disney movie has a main character who faces a challenge. And they want to reach beyond their surroundings, go beyond into a dangerous situation or an area that hasn't been explored. And what usually happens, they band together with some friends, and together they find ways to overcome what has not been overcome yet. And in that process, they learn that to achieve, you need to help one another, both as you offering help and as well as receiving it. So we know what the recipe for hope is, even when learning from Disney films. And finally, I just love this statement by which was said by psychologists, some of my colleagues at the APA podcast entitled "There's Never a World of Enough Hope." Sometimes people have the impression that if we hope, our hopes will be dashed, we will be disappointed, depressed, and that will be a terrible experience. But that's not what psychology finds. There is never enough hope. Hope is not a lack of realization. Hope is not a conflict with reality. It encourages us to go beyond. And when researching this topic, I found myself wanting hope myself. I was struggling. I was looking for hope and trying to figure it out as a clinician. And what happens is clinicians, doctors, medical professionals often think they shouldn't instill too much hope in the parents of children because they'll not prepare them for the tough reality. But the thing is, hope and realism are not in opposition. Hope is hoping despite understanding the situation as it is. And we as medical professionals have to keep in mind being a good parent is inextricably linked with sustaining hope. And rather than a fear of fostering denial, what people recommend, what parents hope for is, I'm hoping with you at the same time of being aware of what can happen. This is sort of a visual representation of that. It has many meanings, but one is that with the petals, some are disappearing and the other is still a flower with all its beauty. And a parent who waters all the reasons, all the feelings of life, as well as appreciating the beauty of life that is passing. So you as a community can co-create hope in many ways. You can create goals, pathways, and that lead to a willpower. You can debate pathways. You can have a shared vision of what could be. Today we heard many talks on the treatments of the disorder. And you can impact government, and you can generate hope through discourse. So to think about hope, maybe the take-home message is, Hope is not a place, hope is a journey. And it's a journey, I guess it's to the end of the rainbow. You know the myth, right? At the end of the rainbow, there's a golden pot waiting for you. Well, guess what? It's not getting to the golden pot. It's taking the journey. Or if I dare cite Emily Dickinson, hope is the thing with feathers that perches in the soul and sings the tune without the words and never stops at all. And sweetest in the gale is heard, and sore must be the storm that could abash the little bird that kept so many warm. I've heard it in the chillest land and on the strangest sea, yet never in extremity it asked a crumb of me. Thank you very much for your time.